Hello, my name is Chatushka Samadhivakara and today I'm going to do a short video presentation about some basic concepts of health. This is my name and the date that I'm doing my presentation, and I'm using this as a flashcard throughout the presentation. First one is the definition of the disease. A disease is considered an acute or chronic illness that can be acquired or can be born with it. It causes a physical dysfunction in one or more body systems, and each disease has generally has their specific signs and symptoms that can be characterized, its pathology and etiology. The aspects of a disease process include etiology, pathogenesis, morphological changes, clinical manifestations, diagnosis, and clinical course. The next one is disease classification. Disease can have an acute, subacute, and chronic course. An acute disorder is one that is relatively severe and self-timing, whereas chronic diseases implies a continuous and a long-term process. It has exacerbations like aggravations of symptoms and severity of the disease, and remissions. It is a period during which there is a decrease in severity and the symptoms of the disease. The subacute is somewhere between acute and chronic. It is not severe as acute and it is not prolonged as a chronic disease. And the spectrum of the disease severity for infectious disease can be during the clinical stage. The disease is not clinically evident but is destined to progress to a clinical disease. And in subclinical diseases, it is not clinically apparent but it is not destined to become clinically apparent, and it is diagnosed with antibody or culture tests. And the clinical disease is manifested by signs and symptoms. In here, the carrier status refers to a person who harbors the organism but is not infected, as evidenced by antibody response or clinical manifestation. This person still can infect others because carrier status may be limited duration, or it may be chronic, or it may last for months to years. The next one is etiology. It is the cause of the disease, and the etiological agents can be biological agents like bacteria and viruses. It can be physical forces like trauma, burns, and radiation. Chemical agents like poisons and alcohol. And it can be one's genetic inheritance, or can be nutritional excess or the deficits. The next one is pathogenesis. Pathogenesis explains how the disease process evolves. It is a sequence of cellular and tissue events that take place from the time of initial contact with the etiological agent until the ultimate expression of a disease. The next one is signs and symptoms. Signs and symptoms are the terms that used to describe structural and functional changes that accompany a disease. A symptom is subjective, that is a complaint that is noted by the person with the disease or the disorder, like pain, difficulty in breathing, and dizziness are some symptoms of a disease. And whereas a sign is a manifestation that can be noted by an observer. It is some examples are elevated temperature, swollen extremity, and changes in pupil sizes, and these signs are objectives. These are objective signs, and it can be observed by someone other than the person with the disease. The next one is syndrome. It is a complication of signs and symptoms that are characterized of a specific disease status. Diagnosis. It is the designation as to the cause of a health problem. The diagnostic process requires a careful history, physical examination, and diagnostic tests. The history is used to obtain a person's account of his or her symptoms and their progression and the factors that contribute to a diagnosis. Whereas a physical examination is done by done to observe signs that alter the body structure or the bodily functions. The diagnostic tests are ordered to validate what is thought to be the problem. They are also performed to determine other possible health problems like that were not obtained from history or physical examination, but may be present given the signs and symptoms identified. The next one is complications. Complications are possible adverse extensions of a disease or outcomes from a treatment. The next one, prognosis. It can be refers to a probable outcome and the prospect of recovery from a disease. It can be designated as chances of full recovery or the possibility of complications or anticipated survival time. Prognosis often is presented in relation to treatment options, that is like expected outcomes or chances for survival with or without a specific treatment. The prognosis is associated with given type of treatment and usually presented along with the risk associated with the treatment. The next one is diagnostic tests. The important factor when interpreting diagnostic test results is the determination of whether they are normal or abnormal. The normal values for some laboratory tests are adjusted for gender and age. And including laboratory tests, the imaging studies like CT scans and other tests. The value of many diagnostic tests are based on their reliability and validity, also their sensitivity and specificity. That's all. Thank you.